Hello, everybody. My name, as you probably already know, is Gary Baumgarten, and I want to welcome you to my latest chat. And today we will be talking with Paul Eisenstein, who is the publisher and editor in chief of the Detroit Bureau. And they concentrate, as you can imagine, since it's the Detroit Bureau, on the auto industry. But he is also going to talk to us in a couple of minutes about a program that he has established there that he hopes to spread like wildfire across the United States of America, where you can help your local first responders. And we're going to get into that program, which is called neighborsthatcare.com, in just a moment. But first, I wanted to talk to Paul about the auto industry and how it is coping. So I want to welcome you, Paul, to this uh, little chat that we're having here on Facebook, on paltalk.com, and on YouTube. And you're looking absolutely fabulous, by the way.
Thank you. Well, I shaved today for the first time in a month, so I don't look like some grizzly bear.
I didn't shave over the weekend, and so I was almost late because I was really scraping away at it to get ready for this. Because, as many people know, I work midnights at Fox News Radio, and so this is the beginning of my day. So that's why I was just shaving a few minutes ago, taking my shower. You can see my hair may look a little wet even at this moment. Tell me, how is the auto industry coping with all this? And also, how were they able at several of the plants to tool over so quickly to create? I think they're mainly making ventilators at several of the plants, right?
Yeah, as a matter of fact, we had a news conference or radio or telephone news conference just a little while ago set up by Ford Motor Company. You may know that the automakers are, in a sense, modernizing that once powerful institution known as the Arsenal of Democracy, where they basically helped lead the effort to produce armament during World War II. Now they're calling it the Arsenal of Health, and we are seeing some very significant things happen. General Motors, for example, has been setting up a plant down in Indiana to produce ventilators, the technology that is desperately needed for those who are most seriously ill as a result of the coronavirus. Beyond that, they're producing masks and some other equipment. Fiat Chrysler is producing masks. And Ford Motor Company is rolling out a whole range of things. So, for example, they're producing some masks, they're producing shields, they're producing, or they will be shortly producing, both respirators and hospital or medical gowns, the sort of things doctors wear when they are in either an operating room or in another highly sterile environment. And this is a major, major step, Gary, to move forward. These automakers can transform what is being done by the regular medical community because they know how to produce things in incredible volume. Ford, for example,
But
is looking to try to knock out something close to 100,000 respirators between now and the middle of June.
But how did they retool so quickly? You're more astute in understanding this stuff, but I am a Detroit boy, and I did cover the auto industry, but I was a general reporter. I didn't cover it specifically. I'm not a specialist like you are. But I do know that when they need to change a model year or they want to actually change from a truck to a car or a car to a truck, it takes them a long time to reset that plant. How did they do it like that? I mean, they did it very, very quickly.
Yeah, they move very, very quickly. You're absolutely right. That's what's pretty impressive about what they've pulled off. And the way they were able to do that, well, in some cases, they're just starting up from scratch. Uh, Ford, for example, with the respirators that they are producing, they have largely taken a design that was developed by 3M, their healthcare department, and they have redesigned it to make use of some of the equipment that they have lying around in regular auto plants. So these are called powered respirators. Respirators, you may recognize them. They have masks. They have tubes that go to basically a fan-like device that sterilizes the air before it comes in. So a doctor can work in a very dangerous situation where there might be a lot of bacteria or viruses floating around in the air. And Ford, for example, they're using the small batteries that they have in some of their plants, and they're using some of the fans that they originally designed to work on Ford F-150 pickups. What's really interesting is that these new gowns that they're manufacturing use the same nylon material that was developed for use in airbags. And it turns out it's not water permeable, and it can be washed. So these gowns can be used over and over again. General Motors is completely retooling part of a plant down in Kokomo, Indiana. That plant will be used to produce ventilators. And again, I think they're going to be using some of the parts that they have internally, and they've worked with suppliers to come up with additional material that they desperately need. It's very interesting how quickly these guys are working.
So with the lockdown in place almost everywhere, presumably sales of cars are pretty much non-existent. In some states, I think your own Michigan, you can buy a car, but you can't go to the dealership. You have to do it online and I guess get it delivered to your house. I don't know how they actually do that. So it's trickled down to almost nothing. So
Yep.
what are the short-term implications to the industry, Paul, and the long-term implications to the industry?
Well, right now we're looking at, let's see, last month auto sales were down about 40% compared to year ago levels. The reality was it was much worse than that seems because the month began pretty well. As soon as it became clear and the president completely reversed himself, no longer talked about being a hoax, but actually said that this is a national emergency, suddenly we saw sales collapse. About 40% last month. In fact, during the very last few days of March, they collapsed as much as 90% nationwide. Here in Detroit, New York City, a few other markets, auto sales have completely stopped. In some cases, dealers cannot sell vehicles at all under any condition. In some states, they're allowed to do at least online sales. And of course, there's a few other states, Texas and a few other states with no lockdown, where things are proceeding somewhat normally. Uh, how much they're going to go down this month is a question mark. The first week of the month was a little better than some people expected, if you call being down 60% nationwide compared to a year ago better. I guess it is. It could be down as much as 80% if things continue to collapse. Automakers are working their tails off to try to find a way to get at least some people back. They're working with their dealers, for example, to do online sales and what you just described, what are called contactless sales. So you'll have a car delivered to your home. They will scrub the entire vehicle down, leave the keys in the cup holder, drop it in your mail slot, whatever. But that's only allowed in a handful of states. So it's looking very bad. And by the way, here's the funny thing. One of the few segments of the market that's holding somewhat okay, pickup trucks. And one of the reasons, on average, the incentives on pickups right now are averaging an all-time record $7,300. We are seeing all-time record incentives across the board, but particularly on pickups. And pickups, of course, as you know, are dominated by the Detroit Big Three. And the Detroit automakers right now are having their best period in terms of market share that they've seen in over a decade.
So this would be, from the consumer standpoint, an opportunity from what you just described.
Yeah, if you can buy, if you need to buy, this is not a bad time. And one of the things you can look at are there are great deals, for example, zero interest loans from a number of manufacturers, some stretching out as much as 84 months. Some of the manufacturers are taking steps so that if you have a short term disruption in your income, you might be laid off or even fired as a result of this. They're offering deals where they will delay your payments. Hyundai has a program going, and I believe I know that their Genesis brand, and I think Kia may. They're all three related Korean manufacturers, where they will actually pick up some of the monthly payments if, in fact, you do wind up out of a job. So there are reasons that you should at least consider it if you think you're going to be shopping in the next few months. I will tell you this, Gary. I do expect that a month or two after the lockdowns, once the manufacturers feel that the industry is able to continue, that the economy at least isn't going to go through another wave of lockdowns, you're going to see a lot of incentives out there as the industry tries to kickstart sales.
So you think, and that leads to my last question on this segment about the auto industry, Paul Eisenstein, and that is, you think that there will be a kickstarting, that the mortality of any of the auto companies is not an issue, at least not yet.
It is definitely going to be a very, very big push by the industry. You may recall, Gary, you've been around at least a few years. You remember what happened after 9/11 when auto sales also collapsed, even worse, at least for a short period, than what happened during the Great Recession. And we had that program. General Motors was one of the first with their Get America Rolling Again program. All signs point to something like that, and some of the stuff we saw in the period when the Great Recession started to show signs of recovery. The industry across the board will have incentives, but again, if you're in a position where you feel comfortable and you may need a vehicle now, you should be looking out at seeing if there's a deal that you can't resist right now. And Gary, if you don't mind, I'm going to add one more point. This is actually, I'll plug in two things that auto owners may not realize. Let's say you are in a bad position right now. What are we up to? 20 odd million people out of a job over just the last 3.5 weeks. If you're in a position where you may be struggling to make payments, uh, and you have an auto loan or a lease, manufacturers are reaching out to their consumers. And if they haven't reached you, you can reach out to them, talk to your lender about the possibility that they will delay payments and even forestall some of the late fees. You may be able to avoid late fees and be able to skip payments, at least for the short term. Also, there was a big announcement today. One of the consumer groups held a news conference to discuss the fact that millions of Americans can claim some money back on their auto insurance. So, you're not driving your vehicle. Well, you may be able to get a discount, a refund to cover the period when you are in lockdown from your insurance company.
Yeah, I noticed that a number of the insurance companies are adjusting the premiums downwardly
Yep.
because their exposure is down. Because one of the positive, if you want to say there's anything positive about what we're going through, aspects of the coronavirus and the lockdown is that there are fewer traffic accidents because there are fewer vehicles there. So their exposure has been reduced. So I want to get into another part that has nothing to do with the auto industry. It really prompted me to want to talk to you, Paul Eisenstein, the publisher and editor-in-chief of the Detroit Bureau, which covers the auto industry, and that is that you and your community have established an initiative to help your local first responders, and it's something that you hope will spread sort of like the virus across the nation. Tell us about it.
Yeah, well, I live in a small suburb of Detroit, a little town called Pleasant Ridge. And we have only about 2,300 people living here, but over 5% are first responders. And I have to tell you, when you check the numbers, it's stunning. It's flabbergasting. You're familiar from your days in Detroit with Beaumont Hospital and Henry Ford Health System. Right now, they have over 2,500 of their doctors, nurses, and other employees showing signs of coronavirus. We have seen lots of medical personnel all over the country seriously injured or dying. There are a lot of folks who've already died trying to save us. In fact, if you look at the numbers of first responders that you might call on the front lines, they are probably being struck down at a higher number than the people who have gone to war for us in any time except maybe the Civil War and maybe, well, maybe some of those who walked ashore during the Normandy invasion or onto the islands like Okinawa. It is incredibly deadly for them. And we want to honor and assist these people. So our first step was right here in the town that my wife and I live in. We started reaching out to, luckily, we have a 501c3 charity called the Pleasant Ridge Foundation. And we were able to do something with them. They are funding, and we're getting a lot of local residents contributing to delivering food stuff to our first responders. Remember, they're working 2 shifts a day in many cases, 6 and 7 days a week, simply trying to get to a supermarket. You know what it's like. We talked before we went on the air about how difficult that is. Well, we want to make it easier. Let them have some food without having to stand in line or give up sleep. Now, once we started doing that project, we had a few folks say to us, why aren't you doing this on a national basis? And so, if we can, I'll talk a little bit about where we're
I
going.
want to know everything about that. The name of the national group is, I've got it written down here, neighborsthatcare.com, neighborsthatcare.com. So tell me, no matter where I happen to be listening to you, how I can emulate what you folks are doing in Pleasant Ridge, Michigan.
Well, if you go to the website, neighborsthatcare.com, you'll see that we have a couple of different pages you might find interesting. You'll also be able to go to a What You Can Do page, and we will give you a whole range of ideas, things that can be very easily done by any group around the country. And we really mean any group. You may belong to a foundation in your town. Some towns have charitable groups. Others have block clubs, neighborhood watches. You may be an auxiliary with the Boy Scouts or the Little League. You may belong to a book club or the Rotary. It doesn't really matter. Whoever you are, you can help your first responders simply by reaching out, doing things like lining up food deliveries from a local restaurant or a bakery or a grocery store. If you don't have the money, you can still do things. It's getting warm out there. Lawns are starting to grow. The last thing these responders need is to be taking an hour away from their brief amount of sleep to go out and mow a lawn. So line up with a lawn care. Get kids to take their lawnmowers and go over and cut lawns. It's very easy to do on the basics. And the good thing is, we'll be posting later this week a resource page, which will tip off people onto all the different resources that are out there. A lot of companies we've seen, let's see, Little Caesars, Domino's, and others come up with programs where they're offering, in some cases, free food that can be delivered to first responders. We're seeing grocery stores that are setting up special hours, just like they have for seniors, where only first responders can go. So check out, again, Neighbors That Care will give you some ideas on what you can do. And over the next week or so, we'll be launching additional services that will show you who can assist you, again, by doing things like providing free food or discounts or the like.
You know, it's one thing to be doing this locally, and a lot of people are doing what they can in their local communities. But it's another thing to share it forward, as you are doing, just basically by telling people how it's been successful in your community. And I presume that as more and more communities get involved with this neighborsthatcare.com, you're going to have other people giving you information that can be aggregated and put out to the rest of us so that we all, as one big community, share with one another the various ways we can help our first responders.
Absolutely. We want to connect with neighborhood groups and others assisting first responders all over the country. So, anybody who is watching or listening, I would love to hear. You can reach us through the website. We have a contact us page, or you can reach out to neighborsthatcare@gmail.com and send us tips on what you're doing. we will mention that as well. Anybody who can assist, if you work at a store, a grocery, a supermarket, a restaurant, please let us know, and we'll be listing that as we increase what we do on the site, such as adding the resource page.
I think it's terrific what you're doing. I appreciate you coming on with me today on Facebook, paltalk.com, and on YouTube, Paul Eisenstein. Please stay safe. I see you are staying at home, which is where you ought to be. I know in Michigan you have another domicile. The governor says you can't go there.
Can't go
So,
there.
yeah, and I understand why, because they don't want people jamming the roads and going into sparsely populated areas to hang out in their summer cottages. And then, God forbid, the coronavirus breaks out in that area. The hospitals just cannot handle it. So that's the reason why. But when I first heard it, I thought that was pretty darn draconian what they were doing in Michigan. But then when it was explained to me the reason behind it, I understood.
Yeah, absolutely. Uh, the problem is that people have been doing this, not just here, by the way, over in Canada. They had a problem with this as well. People were going to their resort locations, and all of a sudden, some of them would get sick. And in many cases, these small communities have little to no capability of handling something as serious as this disease. So they were quickly overwhelming these small town health systems. Plus, they would go out there and they would snap up the food and, oh my gosh, the toilet paper if
Oh
it was
yeah, toilet
available,
paper.
you know,
Toilet paper. Yeah.
local stores. So people really need to think about the impact they're going to have if they leave their home to try to go somewhere else.
Yeah, I have a friend in upstate New York, same situation. He says the locals there can't find toilet paper because folks from downstate have been going up there and hoarding it all. I don't know, understand fully why you have to do that. I think there's a psychological reason behind it, which we're not going to get into now. But hopefully they don't need that much toilet paper. This is going to end sooner rather than later. Paul Eisenstein from the Detroit Bureau, obviously in Detroit. Thanks for joining me today.
Gary, it's been great. Thank you for having me on and for spreading the word about the project. Neighbors That Care, neighborsthatcare.com.
Thank you. And for those of you who are interested, I will be now going over to paltalk.com. If you want to continue the conversation there, it's a free download. And then just click on the Paltalk Global Newsroom, and I will be holding court there. We have some other interesting interviews that I'm scheduling for later this week. So please keep an eye on my Facebook timeline for the heads up on those as well. And as I like to say at the end of all of our gatherings like this, please be safe and peace out.